Dr. Devendra Maheshwari, and he is going to speak on surgical outcome of 50 Prolene Gatt combined with FECO in POAG versus PACG.
So, good morning, respected judges. Today I am going to talk about the comparative study of surgical outcome of Prolene Gatt with FECO in POAG versus PACG. No financial disclosure. As all we know, PACG is considered challenging compared to POAG and higher rate of blindness due to PACG. More often, surgical treatment is the trabeculectomy is a gold standard. However, it is associated with vision-threatening complications. Introduction of MIGS have the array of options, strengthen the armamentarium of the surgical management of glaucoma. Although the safety of Gatt in POAG is well established, while in the PACG are limited. So this is how our trend has been changed in our hospital. We totally changed to MIGS. So coming to the rationale of a study, the persistent iodotropical contact, progress of past damage and trabecular meshwork and Slim's canal, thereby providing the good rationale for doing Gatt in PACG. Literature is limited in Gatt and PACG, and there is no study comparing the POAG versus PACG. So aim of our study to compare the surgical outcome of Gatt FECO in POAG versus PACG. So study design is a prospective, comparative, interventional study. Then 180 eyes are included, 90 in each group, POAG and PACG, and data were collected at 2 weeks, 1 month, 3 months, 6 months, and 12 months. These are the outcomes measured, including IOP, surgical success, reduction of anti-glaucoma medication, and complication. So patients were included refractive medical therapy, showing the visual field progression, and the visually significant cataract and could not tolerate the medical therapy. Patient excluded history of ocular trauma, previous surgery, acute angle closure, or neovascular glaucoma. This is the short video how we did in the GSL, in some cases, not in all cases. So after doing the synecholysis, we can make this small goniotomy, and after we doing the goniotomy, tip has been, especially angle closure, we have to measure how much length you want, and blend the tip, and do the procedure as seen by my previous speaker. And then coming to result, the Stata 17 was used to assess the statistical analysis, and this study size, sample size calculation at the precision of power of 90%. Coming to success criteria, complete success criteria had the IOP more than 5 and IOP less than 21, 18 and 15 mmHg, and qualified success if needed the anti-glaucoma medication. Failure considered if the success requiring any additional surgery or didn't meet the above criteria. So these are the demographic almost similar into all the group, including CDR, mean deviation, IOP, and AGM. Looking for the IOP control almost similar into the both group, and PACG and POAG, it was 13 at the end of 12 months, while the 12 from the 20 into the POAG group. Looking for the IOP reduction is 35% in PACG and 38 in the POAG group. Looking for the, again, the medical AGM reduction is almost similar into the both group. P-value is, at the end the P-value is non-significant. Looking, most beautiful part is there at the end of 1 month. If you look for the patient become medicine free, is 93% POAG and 91% in the PAC group. This is also comparable. And these results are comparable throughout the follow-up period of the 12 months. They almost similar. Coming to the success in PACG group, 85, 81, and 67 into the criteria 1, 2, 3, and similar to the 91, 84, and 72 in the POAG group. Looking at the Kaplan-Meier survival analysis, it shows if we use all stringent criteria, also less than 15%, 18 and 21 is almost similar into the both group. So complication is almost like we have the IP spike, microhypema, macrohypema, AC was almost similar. Only in the PACG cases, we have extra thing is the iododialysis in one case, and really 2 cases require the AC bus in the PACG group. So do the Cox proportional hazard risk analysis showed the higher IBS and IOP and AGM has a success rate comparable to the both group POAG and PACG. Coming to discussion, POAG is well described by all the studies have shown. So these are some studies put forward throughout the PACG, and our results are very comparable to the previous study by the Sarakabi, Chiradasi, and Sayyed et al. Limitation of our study, short duration follows up 1 year, past evaluation was not done, and Indian eyes. So till I think this is the first prospective study comparing the POAG versus PSEG, and Gatt is safe and efficacious procedure for both POAG and PSEG. It has shows a good surgical outcome into the both group with less complication. Thank you. This is my team. Thank you.
Okay, thank you, Dr. Maheshwari. Any questions, anyone?
One question. So the number of eyes were medication free, 93%.
Yes. Yes. Number of eyes.
Number